Hi team! So today we are discussing our client Stacy Starr, who had an open reduction and internal fixation of her right ankle that was fractured during a skiing accident and now has below the knee cast in place. So Stacy has a scheduled e-health appointment with us later this afternoon. So why don't we go through some updates and our care plan? Let's start with Kevin and the assessment.
Hi team, based on her last visit, we found out that she had surgery to fix her fractured right ankle. She's been using crutches for 8 weeks, works as a receptionist, and is on birth control. Based on my physical assessment, her respiratory rate was 22, heart rate was 110. She complained of sharp pain in her right chest upon ambulation and inspiration, as well as having shortness of breath. All of these risk factors and manifestation make pulmonary embolism, or PE, a likely diagnosis. Sharp pain upon inspiration, dyspnea, tachypnea, and tachycardia are the most common manifestation of PE. Stacy exhibited all of these manifestations. Based on our patho knowledge, PE happens when a substance, usually a thrombus from the deep veins of the legs, lodges itself into the pulmonary artery and obstructs blood flow. This obstruction can limit blood flow to the alveoli and the capillary beds and activate chemical mediators to vasoconstrict, which further limits blood flow. This creates a ventilation perfusion mismatch where Stacy is ventilating adequately but is not oxygenating sufficiently, thus causing her shortness of breath. Let's go over lab tests with Parmeet.
Thanks, Kevin. Hi, team. So we did some tests and the results have come back indicating a pulmonary embolism as confirmed by the doctor. To start off with, she has elevated D-dimer levels. Now, D-dimer is essentially a product that's formed when the plasmin protease enzymes degrade the fibrin in clots. Her white blood cell count and brain natriuretic peptide BNP levels are also elevated. EBG interpretations are showcasing hypoxemia, hypocapnia, and the onset of respiratory alkalosis. Troponin levels are also slightly elevated as a pulmonary embolism can cause damage to the right ventricle of the heart. And her ECG is indicating tachycardia and nonspecific ST wave abnormalities. All of these manifestations are common with PE, and these have been considered in conjunction with a series of imaging. Some of the imaging that was done, or some of the other tests, were pulmonary angiography, which is the historical criterion for establishing the diagnosis of pulmonary embolism. After being injected with an iodine contrast, anteroposterior, lateral, and oblique studies were performed on each of the lungs, and one of the lungs showcased a sharp cutoff at one of the arteries where we suspect the PE to be. This was confirmed with a ventilation perfusion scan of the affected lung, showing a mismatch that we definitely need to address in her medical management, as Kevin has indicated how that can be quite dangerous for our patient. CT and chest x-ray were also done. However, these indicate more so the impacts of the PE on the lungs, including indications of atelectasis and pleural effusion that can be contributing to her active symptomatology.
Amazing teamwork and collaboration, guys. We will see each other later for Stacy's appointment. All right, have a great day, guys. Bye.
Yeah.
Hello there. My name is Hannah and I'm an administrative nurse here on eHealth. Welcome to eHealth. How may I help you today?
Hi Hannah, my name's Stacy Starr and I think I have an appointment at 3 p.m. I believe it's with the orthopedic clinic.
Hi, Stacy. Pleasure to meet you. Great. I'll set you up shortly. Is this your first time using eHealth? Also, I see that you're using some ski gear.
It's quite convenient, to be honest, with all that's going on. And yeah, thank you for noticing, by the way, my ski gear, because it's like day 7 of like self-isolation. I miss.
So what's going to happen today is I will link you to the orthopedic clinic and our team, and we're going to go through an assessment, any updates, and everything you need to know in the convenience of your own home. I'll transfer you now to our nurse, Kevin, that will go through some assessments with you. All right, sounds good?
All right, sounds good. Sounds good, Hannah.
Okay, thank you, Stacy.
Thank you so much for your help, okay? All right.
Thank you, Hannah, for the transfer. Hi, Stacy. My name is Kevin. I am one of the e-health nurses here. I'll be asking you a couple of questions to assess you, if that's okay with you.
Hey Kevin, yep, that's all right with me. All right with me.
I can see from your file that you're currently working as a receptionist. You had surgery to fix your fractured right ankle. You're currently on birth control pills. You don't smoke, and you've been on crutches for the past 8 weeks. Is this all correct?
Yep, that's all correct information, Kevin. Yeah.
Perfect. What is your main concern right now?
I mean, the main concern is my right side, the pain.
When did you first notice the pain in your chest?
When I went to visit you guys last for my follow-up.
What makes the pain better and what makes the pain worse for you?
It's worse when I walk around the house trying to do some chores.
How would you describe your pain?
Um, it's sharp when I breathe in, so I like that, and then it hurts a little bit right there.
Do you feel the pain anywhere else?
No, it's just constricted to that right side.
What would you rate the pain from a scale of 0 to 10?
I think about 6.5 is 6, something like that.
Is there a time of day where the pain is worse or better?
Probably in the morning when I'm up to do my chores and my daily routine.
And what do you think is causing the pain?
I'm not too sure what's causing it, to be honest. I mean, it has to do something with my cast and the surgery, but I'm not a doctor, so I'm not too sure what's happening with me.
Can you show me your cast and wiggle your toes for me?
Yeah, the cast actually does feel a little bit tight. Let me show you. Yeah, there you go. Oh, there you go. Okay, there you go. Don't mind my toes. Couldn't get them done.
I can see that you're able to move your toes and that there's no paleness or any color changes, which is a good sign. Before your visit, I had a discussion with my colleagues regarding your case. Based on the assessment and the test that we did for you, the doctor suspects a pulmonary embolism.
Uh-huh. And what is a pulmonary embolism?
Great question. A pulmonary embolism is when there's a blood clot that develops within a vein in your body. It's usually in the legs, and that clot breaks off and travels to an artery that goes to the lungs. This can block blood from flowing freely to a part of the lungs and may give you signs and symptoms such as feeling short of breath, having a fast heart rate, breathing faster than normal, and having chest pain that is worse while you're breathing in. Some risk factors for a clot to form include limited mobilization, having recent surgery, and taking birth control.
Oh, I thought I was just getting out of shape, you know? You know what I mean?
Let me link you over to Parmeet and have her discuss the results for you.
Okay. All right. Thanks, Kevin. Bye.
Hi, Stacy. So nice to see you again, and I'm so happy to see that you're doing a little bit better. So we finally got all the results back from all the tests that we did, and I talked to the doctor, and we've confirmed that it is a diagnosis of pulmonary embolism. Just quickly go over what the tests were and what the results were.
Awesome. Test results. Okay.
So we found that your D-dimer levels are elevated, which indicates that there is a clot that's being broken down, which refers to the PE. Your white blood cell, BNP, and troponin levels are also increased, and these tell us that there is perhaps some damage that's occurring to the chamber or the ventricle of the heart on the right side, which often occurs with a pulmonary embolism.
Okay.
All of this was then confirmed with the imaging studies that we did. So the pulmonary angiography, which we always use to establish whether or not there is a PE present, has shown this sharp area of cutoff where we expect the blood to continue flowing, but it doesn't past a certain point. And that's telling us that there is a pulmonary embolism or something blocking it there. So we have a good idea of what's going on, and at least now, and we can move forward to manage this medically alongside with you. I hope you're doing well, and I look forward to seeing you in person soon in the clinic. Thanks.
Hi Stacy, my name is Natalie and I'm going to be your nurse for today. So I'm going to be discussing your plan of care with you. So for pulmonary embolism, our goal is to restore blood flow and also manage oxygen levels. So I can see from your previous set of vitals that your oxygen levels were a 96, which is acceptable. However, if they fall below a 94, we will need to provide oxygen to bring these levels back up and also manage your high heart rate, your high respiration rates, and any changes in mental status. So sometimes with patients that have low oxygen levels, they may become confused, and this is why we're going to be providing oxygen. Also, I noted that you had chest pain when you were breathing in, and this is known as pleuritic chest pain.
Okay, I see.
So it's a common symptom of a pulmonary embolism, and we're going to be managing this pain with pain medications, or we can use other techniques like relaxation or distraction.
Oh, perfect. So I can take a nice warm bath for relaxation, or even watch like my favorite TV show to distract myself.
Some of the medications that your physician may prescribe for a pulmonary embolism. So these medications include anticoagulants like enoxaparin and warfarin, and these medications help prevent the clot from growing bigger in size. Other medications such as alteplase, streptokinase, and urokinase are thrombolytics, and these medications help decrease the size of the actual clot that is inside of your lungs. So because all these medications prevent clotting, we want to look for signs of bleeding. So this includes pink-tinged urine, having a tarry black stool, nosebleeds, gum bleeding,
okay.
and with the thrombolytics, we can also look for difficulty breathing, and that would indicate a bronchospasm or airway constriction.
Right.
Do you have any questions?
I mean, no questions for now. I can call you guys if anything, right?
And I will be transferring you to Irina now so you can discuss your interprofessional care.
Thank you so much, Natalie. It's so nice to talk to you. Bye.
Thank you, Natalie. And hi, Stacy. My name is Irina, and I'm one of the interprofessional e-health nurses.
Hi, Irina. It's really nice to meet you.
So when discussing your case with my colleagues, we created a list of suggested team members that would benefit your recovery. So as nurses, we have the knowledge and skill to assess, educate, and inform our patients. We also have the ability to arrange at-home care if our assessment finds that our patients would benefit from such service. So sometimes patients would need dressing changes, so we would offer such services in order to do their dressing changes. I could send you more information to look over about this service. And is this something that you feel would benefit your recovery?
Of course, yeah. I would love for someone to come over and take a look at my cast. Yeah.
Okay, great. Yeah, so I can send you the information. And since you had a surgery on your right ankle, a follow-up orthopedic appointment is important in order to continue monitoring the healing process after your surgery. And it is also important that you visit your doctor 2 weeks after your operation. Your doctor will refer you to other medical resources, adjust current medications, prescribe new medications, and order further tests as needed. Next, we have respiratory therapy. So this will be used to enhance your respiratory ability and decrease recurrent PE. So physio will also work with you to improve your mobility, range of motion, and teach you appropriate use of crutches. Occupational therapy will assess your home environment and suggest how to modify your home in order to allow you to live independently as possible. So I will send you all the information right now for you to look over. All right, bye now.
Thank you so much. I love e-health. It's so convenient, so accessible. I'm so glad I called today. I really am. Like, whew, I feel good.